in this video we're gonna learn why do your gums bleed and how to prevent it. And if you stick till the end of this video, I'm sure you will have more information regarding your status of your oral health and how should you prevent it or take care of it better. So did you know that you have over 700 types of different bacteria in your mouth and microorganisms that live in perfect harmony? But if something occurs, let's say a disbalance of that harmony, like food retention or bad oral hygiene or some systematic diseases and anything else, then this balance is shifted into an imbalance. What does it mean? It means that some bacteria become more opportunistic in creating their own, and they start growing more rapidly than other bacteria, which we call a drop of pH level occurs, which you have probably seen in some chewing gum commercials, that line that shows pH level is dropping down. So this is something that happens, and the product of this is the acidic metabolic products of the bacteria that causes tooth decay and cause different types of inflammatory process of the surrounding tissue around the tooth. So gum bleeding, which is called in general gingivitis, is a immunological response of this metabolism, or in some other cases, in most of the cases because of that. The reasons of inflammation of the gums could be from bad toothbrushing till plaque accumulation and misaligned teeth that have food retention in between. If you want to learn more about how you can properly brush your teeth, you should check my other videos regarding tooth brushing, plaque accumulation and stuff like that, so you have better understanding on what is going on in your mouth and how you should treat it better. If you have any types of crowns, veneers, orthodontical appliances in your mouth, implants or implantopprosthodontics that have been poorly done, let's say have a bad connection with your organic part, because why? You have your organic component, your remaining tooth structure, your remaining bone structure, your remaining soft tissue, and you have something foreign, a crown, an implant, a bridge pointing something. These connections formed are really important to be as, let's say, healthy as possible, in terms of there shouldn't be any retention spaces there that are hard or impossible to clean from your own point of view regarding using your toothbrush or your dental floss or any other appliance for maintaining oral health. Something you should check with your dentist if you have some persistent gum bleeding or infections in some areas that are prosthodontically involved. They're involved with different types of prosthodontic appliances. Gingivitis can also be caused by bad fillings, which is also a, let's say, foreign body, which is also a foreign body in your mouth, and you should check with your dentist also to fix those bad connections. Calculus, how we call it tartar sometimes, it's a hardened plaque, which is a result of combination of plaque accumulated in the mouth and the metabolism and the components of your saliva and the metabolism of your salivary glands. So when he hardens, he can cause retention spaces for bacteria in the areas of your gums, which is usually around the lower incisors, because there's a pool of saliva in there, which is normal physiologically, but there's more areas that then hardened tartar can accumulate. Also there is one more particular space where tartar can accumulate, and this is on your upper first molars, major salivary parotid gland, which is located in the frontal part of your, a little in front of your ear, can also excrete saliva, and there you find in your cheek the place where the saliva comes out, and this is also a place where plaque can accumulate and tartar can accumulate. If gingivitis persists, let's say for a longer period of time, and there's a constant infection around it, then there's not only that the soft tissue is involved anymore, it can spread more further and cause damage to the surrounding periodontal and bone tissue, and causes this what you already knew as periodontitis. So when you have a gingivitis, you have only inflammation of the soft tissue. When you got periodontitis, you have a combination of inflammation of the periodontal ligament, the bone structure, and your gingiva. So it's really important to take care of these bleeding problems in start to get rid of some potential major complications surrounding your teeth in the future. Systemic diseases like diabetes, like HIV, or any type of immunosuppression diseases from leukemia, or some blood diseases, let's say problematic, some problems with your red blood cell count or your thrombocyte count can cause more rapid bleeding of the gums. There's also some types of diseases can cause growth of gums, which then cause more retention spaces for food to accumulate, such as some types of leukemia. There's also some types of medication that can cause a loss of saliva in the mouth that can increase the rate of cavity and gingivitis development, or it enlarges the gums of your mouth, let's say like ion channel blockers or some types of epileptic drugs. You should really check your drugs if you're consuming any type of treatment on your daily or larger basis with your doctor, if there's any side effects regarding your oral health, so you can put it down to minimum. If you have any questions regarding this topic, you can comment in the section down below. I hope you like my video. You can check my other videos as well. There's a lot of nice information for you folks to learn more about your own oral health and how to improve it and how to reduce any possible complications via simple methods and way. I hope to see you soon. Bye.